Welcome to 24/7.
Also, during the first week, after
that particular
second important thing
from the beginning
is the fact that
the last time.
Welcome back to 24/7 Head Matters. I'm your host, Dr. Dayo, Dr. D for short. It's my pleasure to be with you once again. Our last edition began the topic on how to create a realistic and workable health plan for 2026. I hope you learned a lot from it. I hope you remember the realistic framework. Very powerful when you want to plan your health for 2026. Today, we'll be looking at a very, very important aspect of health goal planning for 2026. We'll be looking at the domains of your health, or indices or indicators of your health that are very critical, that are very important. Those ones that truly matters. The reason for this is because most of us, we measure wrong metrics, different parameters that are not important. Sometimes you want to lose weight, maybe for the wrong reasons. You want to have 6 packs, or you want to look lean like a model. But the question is, will this prevent early mortality? Also, will this health metrics that you're measuring, will this stop you from developing diabetes? That is the most important thing you need to have at the back of your mind. The first domain or health domain that I'll be talking about, which is very, very important, which is the foundation of every other health domain, is the metabolic domain. It is the foundation. It's very critical. And it is important to talk about it. So metabolic dysfunction is the root cause of so many non-communicable diseases, including diabetes, hypertension, fatty liver disease, polycystic ovarian syndrome in women, erectile dysfunction in men, and many cancers also have been attributed to metabolic dysfunction. So just the list is endless. Over 70% of adults has at least one of these problems that I've talked about. Diabetes, hypertension, at least including even dementia. So you see why it is very, very important to talk about this. So let's talk about the core metabolic indicators that matters. The number one is your waist circumference. Now you wonder why I'm not talking about weight or body mass index. The reason is because your waist circumference predicts whether you're going to develop certain metabolic conditions more than the weight and the BMI. So your waist circumference reflects your visceral fats, those fats within the organs and within your belly area, as against your subcutaneous fat, that means the fat under your skin. Your fat under the skin are relatively healthy, but the fat within the organs in the body and around your belly area are very, very toxic and dangerous for your body. Your visceral fat, that means the fat within the organs and the belly area, produces a lot of hormones and a lot of inflammatory markers that are toxic and poisonous to a lot of tissues in the body. So that's the reason why it causes a condition we call insulin resistance. That means it makes insulin difficult to be used by the body. So what waist circumference predicts development of all these conditions, especially diabetes? Globally, and especially among Caucasians, among white people, the waist circumference of over 102 centimeter in male and of course 88 centimeter in women predicts the likelihood of developing diabetes. We have lower thresholds for the Asian population. The risk threshold for men is more than 90 centimeter, while for women is more than 80 centimeter. If you go down a little bit to the South Asia, the threshold for men is more than 88 centimeter and 77 centimeter for women. In Africa, there is no consensus yet. There is no single universally agreed threshold for African population. However, there is a lot of consensus being built in this regard. So to date, we have different studies in different places. Like, for example, the African born in the United States, the threshold for development of diabetes is the waist circumference more than 91 centimeter for men and more than 96 centimeter for women. Among Nigerians living in urban area, the waist circumference of greater than 83 centimeter for men and more than 91 centimeters for women predicts development of diabetes. Among some Black South African population, they found a waist circumference of greater than 96.8 centimeters for men and greater than 95.8 centimeters for women as clinically relevant and important in predicting diabetes. What is most important for you to remember here is that the individual with a higher waist circumference is likely to develop metabolic condition like diabetes as compared to someone with a lower waist circumference. So let's look at two individuals. Let's say individual A versus individual B. Individual A has a waist circumference maybe in the region of, let's say, 120 centimeter. But the individual is weighing about 50 kilograms as compared to the other person who has a higher weight. Let's say is weighing 80 kilograms, but the waist circumference is 75 centimeter. The individual A is more likely to develop diabetes, even though B has a higher weight. So it's about your waist circumference more than your weight or your BMI. So think about that. The reason is because sometimes people weigh higher because of the long bones. You know, your long bone also play a huge role in your weight. So it's not just about fats. So it's very, very important for you to remember that. The second and third metabolic indicator of importance that I'll be talking about are your blood sugar. So your blood sugar, there are two parameters that you'll be looking at: your fasting blood sugar and also your post-meal glucose. Yeah, we usually measure fasting blood sugar, and a value less than 5.6 millimole per liter or less than 100 milligram per day, depending on which unit you're using, is desirable. So keep that at the back of your mind. But sometimes somebody may have a normal fasting blood sugar, but when you challenge the pancreas through a standardized glucose meal, the blood sugar may be abnormal. So sometimes we do a test called oral glucose tolerance test to determine whether the individual indeed has or diabetes indeed. So if you challenge the glucose through the test we call oral glucose tolerance test, and then you measure the blood sugar after about 1 to 2 hours, a value of less than 140 milligram per DL will be ideal. The third parameter is your glycated hemoglobin, or HbA1c. So this measures the period during which the body is exposed to glucose. So, and it is also a very, very important indicator. As a matter of fact, value below 5.7% is normal. Value between 5.7 and 6.4 puts you at what we call the pre-diabetes phase, while any value above 6.5% means that you have diabetes. So it's very important to look at these glucose parameters that predicts whether you have diabetes, pre-diabetes, or you're within normal blood sugar bracket. The next indicator of metabolic function is what we call the ratio of triglyceride and your good cholesterol. That's the HDL cholesterol. Now, let me give you a little bit information about the cholesterol, the fat in the body. So there are about about 4 different kinds of fat in the body, using layman's word. So we have the triglyceride, which is the fat that is produced after, carbohydrate or in response to calorie or sometimes alcohol. Then you have the HDL cholesterol, which is the good cholesterol. To remember that movie, The Good, the Bad, and the Ugly. So the good cholesterol is good because it mops excess of cholesterol from the body and transfer it into the liver. So it helps you to prevent atherosclerosis. That means fat building up within your blood vessel, which of course is the harbinger for development of stroke and heart attack. So then the next one is the LDL cholesterol, which is the bad cholesterol. So the bad cholesterol, what it does is that it transports fat from the liver into the tissue, into the cell. And so the excess of LDL or the bad cholesterol often lead to atherosclerosis. Then of course I've mentioned triglyceride, which is the ugly. So all these three things are very important and they are measured. The addition of this actually will give you what we call total cholesterol. So there's a formula for calculating that. So you add your good cholesterol, the HDL, plus your bad cholesterol, which is the LDL cholesterol, plus 20% of your triglyceride will give you what we call total cholesterol. Now, in the next, I will be talking a little bit more about that when I get to the cardiovascular health domain. So, going back to the measure of insulin resistance. So one of the markers of insulin resistance that is usually underutilized is the ratio of your triglyceride and your HDL cholesterol, that's your good cholesterol. A value greater than 3 milligram per DL will be abnormal. It's a concerning value that you should worry about because it predicts development of insulin resistance or even diabetes. I do not intend to make this video to be too long and boring for you, so I would rather take each of these domains one after the other. So today we talked about the metabolic domain, which I said is the foundation. The next time we'll be looking at another very important domain, which is your cardiovascular health domain. As you know, cardiovascular disease is now the leading killer globally. So I hope you will join me during that edition and you learn so much. I believe you learned something very valuable today. Please like, share, and subscribe, and also hit on that notification button so that you can receive future content from us. It's good to have you with me once again. I'm your friend, Dr. D. I'll see you next time. Keep healthy.